opportunities in primary care are really around prevention.
Yeah.
So prevention is by far the most cost-effective investment, of course, and so I'm very optimistic about those extending and spreading. And what's going to be really interesting is whether we can enable the same kind of changes to start to happen in our hospital systems, which are going to be much more difficult. It's a much more complicated environment. Hospitals are also, they have larger fixed costs. They have thin margins.
Yeah.
The average margin for a hospital was 2% last year, so much more risk averse in terms of thinking about trying new payment models. But if I think Churchill said, never waste a good crisis. So there is a moment now that we're facing with the COVID crisis where we may be able to see some innovation, some willingness between payers and provider systems to partner more effectively to try out some new models.
So it strikes me, you mentioned hospitals. It seems to me, I'm an advocate for a much more free market system, an idea that whose time will probably never come, but I like thinking about it anyway. It seems to be one of the challenges to my view and to your hopefulness about other ways to get there from here of avoiding the fee-for-service is that there's a big difference between going into the doctor for a blood test, your primary care physician, say, or going into your primary care physician for a sprained ankle or broken finger versus going into a surgery center for a hip replacement. Those are all kind of similar because you kind of know the hernia, the appendicitis. There are surprises, but the standard of care is pretty straightforward. Once you get into the ICU and you get into complications and post-surgery stuff, the menu of stuff you can do or try, it's again a glorious testament to human creativity and innovation, but you can have whatever you want. You can do you can do so many diagnostic tests, and it's not always clear what it's not like replacing the hip. There's so much variation. It seems to me that's going to be a big challenge in any of these ways to make things better.
I think it's a challenge. It's also an opportunity. One of the lessons that I try to talk about in this book, The Long Fix, is the opportunity to create what we call the learning health system. We are beginning to see the rewards of investing in digitizing all of our health data in hospitals through these electronic medical records. In the beginning, I believe that they've been primarily used as very expensive billing and coding machines.
Yeah.
But over time, I think we are starting to see that there's a lot that can be learned from experiences with very complicated patients with very complicated conditions. One area, for example, that I have thought about a lot is my own. I'm an MRI radiologist, and reading MRI studies from patients who have a whole wide range of diagnoses and conditions get very little feedback over the years in terms of just what actually happened with that patient. Was that diagnosis that I made correct or not? Or if the diagnosis was correct, which hopefully it was, what happened to that patient with the different therapies that were tried? That information is actually all in those electronic medical records, right. And the question is, how can we extract useful insights from it? That would be the case, I think, in the intensive care unit more than any place. We have pretty good understanding, as you said, of how to care for a patient who might need an artificial hip or caring for a patient with appendicitis. But patients with sepsis, very complicated. Right. All different kinds of sepsis. Sepsis really isn't one diagnosis. So how can we learn more about that? And there's been some really interesting research that's shown with artificial intelligence that we can actually start to detect sepsis much earlier with these automated algorithms. They can use AI to identify earlier than we would ordinarily be able to detect as clinicians. Those kinds of capabilities, I think, are just in their infancy. So I hope that our investment in digitizing our healthcare system is going to finally pay off there.